Ambulance, what's the address of the emergency, please? Okay, and the telephone number that you're calling from? And are you with the patient now? Is there any registered nurses there, officers? Right. Is the patient completely alert?
What you're seeing here is a real emergency, but is it always necessary to call 999 or indeed visit your local accident and emergency department? If you are feeling unwell, make sure you go to the right place at the right time.
The ambulance service is a 24/7 emergency service that can be accessed by any member of the public using the 999 system.
Ambulance, what's the address of the emergency, please? Okay, and the telephone
We're an
number
exceptionally busy service. We attend 500,000 calls a year, which equates to one call every minute. Any type of medical emergency or traumatic emergency. Patients that are severely injured or are suffering from a medical emergency, they get the fastest response. If the patient is suffering from acute chest pain, acute breathlessness, sudden loss of consciousness, if they've been traumatised anywhere, fall from a height, then ring 999. And we get calls for people with injuries that you would not class as life-threatening. We get calls from people because the telly's broken. We get calls from people whose cat's escaped and they can't find it. Ambulance resources are not infinite, and we expect the members of the public to ring for an ambulance only when necessary.
A lot of it is in the name. A&E is accident and emergency. If you've had a significant accident or you think that your illness is an emergency. If you've got severe chest pain or difficulty with breathing, if you've had a significant head injury, you think that you've sustained a broken bone, then that would certainly be something that we would expect to treat in the accident and emergency department. Around 5 to 10% of the patients we see should really have gone somewhere else. And then there's another group of people who could have attended their general practitioner, but they perceived that their problem was too urgent to wait. On a busy day here, we will see 200 plus patients, and we're a small department. At times, we would only have 2 doctors and 2 nursing staff in the department. So we could end up with both doctors and potentially both of the nurses in the department trying to look after this one patient, and it might take them 3 or 4 hours. Would have actually been seen in a more timely fashion if they'd accessed healthcare elsewhere.
It is particularly important to register with a GP in order to access healthcare quickly and efficiently. Some good examples of when a patient should visit their GP can include things like a common problem or an illness not settling down after 24-48 hours, children under 1 year old, and other common things like back pain and vomiting if they haven't settled within 12 to 24 hours. If you do have an urgent problem, you can always contact a doctor. Just mention it to the receptionist and she can usually put you through to a doctor on call, or the doctor will give you a call back within a few hours. Pharmacists are an excellent resource and are sometimes not used very well. Often have a private room in their pharmacy where you can have a confidential consultation. They can give you lots of information on common ailments and medications. Preparation for bank holidays is important, and the key thing, if you are on lots of medication, to request your repeat prescription with plenty of time. Practices usually need about 48 hours for this. There are plans to simplify the service by using one number, 111. This service will be free to call, and it's currently being tested.
Many patients can probably make themselves feel better by using remedies and medications that they can purchase from supermarkets and pharmacies. Pharmacists who are well trained, very knowledgeable, and able to give advice to patients without an appointment. I think there are certainly some standard remedies that would be great to have in every medicine cabinet across West Yorkshire. Things like simple pain relieving medicines, anti-allergy treatments, and perhaps some treatments for upset stomachs wouldn't be out of place in any medicine cabinet. GPs are trying very hard to be more accessible, so as well as our standard opening hours of 8 o'clock in the morning till 6:30, many practices now offer extended opening hours, perhaps from 7 in the morning up until 8 o'clock at night, and some Saturdays as well. Outside of those hours, if you phone your surgery, you should be put straight through to the local out-of-hours GP service. Or if you're not put straight through, there should be a simple telephone message telling you which telephone number to phone. If you're not sure which service to access, then NHS Choices, which is available on the internet, or NHS Direct, which is available on the internet or via telephone, can give you advice. If you feel that the illness that you've got needs the advice of a GP, then the out-of-hours GP service in this area is called West Yorkshire Urgent Care, and they can be contacted either directly on their number, which is 0345 605 9999, or if you can't remember that number, just phone your GP surgery, and even though your GP surgery is closed, they'll put you through to the out-of-hours service called West Yorkshire Urgent Care.
West Yorkshire Urgent Care service is a telephone-based urgent care service for people living in the West Yorkshire area for minor emergencies and urgent health care. It's staffed by GPs, experienced nurses and health advisors. It's a unique number, it's 0345 605 9999. An appointment can be made, if it's appropriate, at a local treatment centre. It's a case of getting the right person to the right treatment centre to see the right person. We are able to get interpreters very quickly, and most dialects, most languages can be accommodated. We never close. It's 24 hours, 7 days a week, 365 days a year, including bank holidays, Christmas Day, Boxing Day.
Good morning, you're through to NHS Direct. My name is Adam, a health advisor. Can I take the telephone number you're calling from,
NHS
please?
Direct is a 24-hour confidential nurse advice line, and it's open 7 days a week, 365 days a year. We don't close, we're open on all bank holidays.
I'll get some nurse advice for you, okay? All right, thank you very much indeed. What's your first name, please, with spelling? Thank you. Okay, so how long have you had this earache for, please?
There's also the opportunity to access the website. There's a symptom checker, and just more recently there's access on mobile phones with apps.
Remove the patient and yourself from the source of the burn and any further danger.
The service receives approximately 14,000 calls a day, so it is very busy. We do have access to interpreters, and that can be dealt with within a few minutes. It's much better to call NHS Direct because a full assessment can be made of the symptoms, rather than if they're feeling quite unwell then sitting in A&E where it may not be appropriate, and they may then be asked to go back to the GP. It saves them a journey. We can point the caller in the correct direction for the symptoms that they are experiencing. NHS Direct is a 24-hour confidential nurse advice line, and it's open 7 days a week, 365 days a year.